welcome to Medical Dialogues. I am Dr. Nandita Mohan, and today I have a very interesting topic to discuss with all of you. Now, we all know that constipation is a common problem in pediatric age, with prevalence often ranging up to 29% of normal frequency, and consistency of the stool varies with children's age as well as their diet. Now, there is also a considerable variation across children, that is, each child is definitely different. So, to give us more information about this interesting or this important topic, we have with us today Dr. Lavanya R. Padmanabhan, who is a consultant at pediatric gastrology and hepatology.
See, constipation in children is very, very common, as you mentioned. And we medically kind of categorize it into two broad categories. One is called functional constipation or habitual constipation, which is something to do only with our lifestyle. And the other category is what is called organic constipation, where there is actually a problem that is triggering or presenting as constipation. So there is some medical problem that needs to be identified and treated in addition to managing the constipation. Now, coming to functional, because that is the commonest problem in the community. More than 95% of our children who have constipation, it is just simple functional or habitual constipation. Now, the trigger factors, quite varied, depends on our lifestyle and dietary choices. Dietary choices in younger infants as well as in older children both matter equally. So in infants, like too much of milk guzzlers, abrupt transition of diet from breastfeeding to some formula or to solid-based diet without adequate fluids. Older children, lack of fiber in their diet, a lot of junk foods which has kind of become a norm for us, even though we don't realize how much of junk foods we're taking in. And the certain kind of beliefs about avoiding certain fruits, certain vegetables which are thought to be dangerous, not good for us, such things, plus inadequate fluid intake, because that's a very common problem, especially in school going age. They forgetful, the bottle comes back exactly the same, hardly half the bottle is drunk. Factors. In addition to that, toilet habits right from infancy for the young children. There's no time in the morning, they're busy with whatever work they have, playtime they have, so postponing or hardly spending a minute in the toilet. So these are some of the factors. In addition to that, there are certain unexpected changes in our environment. Say a young child starting nursery, starting school, it can be a stressful factor for the child. Children who don't like to use the school toilet or toilets when traveling, and intercurrent infections these children get. The use of repeated use of certain medications, including our common cough syrups, pain medications. So there are factors that can trigger functional constipation. And coming to the organic constipation, where I said there is actually some other problem going on with the child, and you got to the constipation as well as the primary problem. So common things in children: milk allergy, we call cow's milk protein allergy or CMPA. Children who have gluten allergy in a genetically predisposed individual, what is called the celiac disease, and the other problems like thyroid issues, certain metabolic conditions. When a child has muscle weakness or nervous weakness due to various reasons, spinal cord problems that affect the legs, that affect the bowel and bladder habits, conditions like Hirschsprung's disease, where there is a problem with the innervation of the large intestine, the nervous problems, where the problems onset quite early on in life when they are very small babies. And in some kind of rare scenarios, when, for example, a child is on a lot of pencil containing lead intoxication, you've got high environmental lead levels from the water. So these things can also cause.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.